Good morning, everyone. Uh, my name is Dr. Manthan, and welcome to Physiodynamics. Today's topic is difference between cerebral palsy and developmental delay. Many of the followers have asked for this specific topic since a long time, so we are going for it now. So, what is basic difference between cerebral palsy and developmental delay? So, this is my understanding about cerebral palsy and developmental delay, and this has been taught to me by my professor and guru, Dr. Nilima Patel. Every child with cerebral palsy has a developmental delay, but every child with developmental delay doesn't have a cerebral palsy. So, next presentation, few of the slides will be explaining this, and later on, you'll be able to understand why I'm saying this, that every child with cerebral palsy has a developmental delay, but not every child with developmental delay has cerebral palsy. So, what is my understanding of cerebral palsy? If we go according to the definition, it's a group of permanent disorders which will lead to a difficulty in development of movement and posture, and which is attributed to a non-progressive injury to the brain. It can be before the birth, at the birth, or after the birth. Injury can be before, at the birth, or after the birth. And even though it is primarily a motor disorder, it can affect the sensation, perception, cognition, communication, and behavior of the child. Whereas if we see a developmental delay is, in simple terms, it's a delayed milestone. So its basic difference is the child is not able to achieve a particular milestone where it's supposed to as compared to the peers. Now, primarily, if you see, there are two types: isolated and global. Isolated is when the child is only able to not achieve or cope up with only one domain of developmental milestone, as in like a motor delay. Or when there is a two or more component of the domain is affected, like cognition is affected or communication is affected along with the motor developmental delay, then it is termed as a global developmental delay for that particular child. Primarily, similar causes are there in cases of cerebral palsy and developmental delay. It can be before, at the time of birth, or after the birth. If you see a case of cerebral palsy, primarily it can lead to maternal infection or gain intrauterine growth factor which is affected, or there is any hypoxia, anoxia, or during the birth, is there any hypoxic ischemic encephalopathy, then it can be affected and it can lead to a motor disorder. Whereas prenatal risk factors for developmental disorder, especially in India, is genetics, nutritional deficiency, microbial infections, chronic disease, as well as drug abuse. Even genetics is a primary factor which can lead to a developmental delay, like a Down syndrome. Now, if we see about the types, according to the movement disorder, it can lead to a spastic, hypotonic, or ataxic cerebral palsy, or it can be combination, which is called as a mixed cerebral palsy. Whereas topographical classification, it can lead to a monoplegia, diplegia, and as well as quadriplegia. According to the involvement of the part of the brain, it can lead to affection of one hand, two legs or two arms, and the quadriplegia. Yeah. So when we move forward to developmental delay, I already explained about mild, moderate, and severe. Mild is when we see the Bell's graph, as the child who is going away from the normal function at that time, the affection is more. So it can be a mild, moderate, or severe. I already explained about isolated and global developmental delay. So now when we move forward to on assessment, how we are going to identify this children with developmental delay or cerebral palsy. So in a primary care setting, the child will be coming in the developmental clinic or a high risk clinic, and pediatrician is going to evaluate and observe the developmental sequence, or going to do the developmental screening. Secondary, parents will be coming with the concern that my child is not able to cope up with the developmental pattern, like my child is not walking though he is 1.5 years or 2 years of age. Or the teachers are reporting that your child is not able to. Teachers are reporting to the parents that your child is not able to cope up with the class, or not able to communicate the same way the peers are doing. So these are the usual way we are getting the child. Now, if we see a guideline which has been formulated by American Academy of Pediatrics, even the eliciting and attending the parents' concern is also very important while we are evaluating a child who might be having a developmental delay, obtaining a developmental history for each and every child, obtaining a developmental history and maintaining that is very important. Making accurate observations of the child. So Pathway Organization is also approved by American Academy of Pediatrics, which is giving a checklist for each and every developmental domain. So this can be given to the parents for India for sure. The primary, the literacy and everything is going to be there because it's in English language. Those who are able to understand, we can give it to them. They can mark, and it's a simple checklist which can be followed by the parents. To formulate it for the parents, and if there is any delay, parents can come back to you. So that is very good strategy for do the surveillance at home, identifying the risk and protective factors. That's why the high risk clinics are being operated, and maintaining an acute record of process and finding, that is also very important. Now on presentation, how they are going to be like. So cerebral palsy, when you see a child, there might be that the first factor is going to be abnormal tone. When you hold the child earlier, 5 months, 6 months old child, there should be some extensor tone in the neck, whereas this child are going to be floppy in nature when you hold them. Atypical posture is going to be there, like asymmetric tonic neck reflex is going to be there. If it is beyond 6 months, it should be integrated by that. But if it is still persistent after that, then it can lead to atypical posturing because of that pathological activity. Now, involuntary movements in terms of especially seen in dyskinetic or taxic cerebral palsy and delayed motor milestone. That is also one of the primary presentation of the child with cerebral palsy. If we see a developmental delay, primary symptoms will be based on the affection of the domain. If it is motor delay will be seen. Language and communication, it is having receptive as well as expressive, and child is not able to cope up with the peers in terms of specifically a communication domain. Now, when we go for the comprehensive PT examination, three things need to be understood: chronological age, milestone age, and reflex age. Why it is important? Chronological age is the normal age of the child, what is birth age. Milestone ages in particular domain, like a motor milestone, child is not able to cope up, and what is the current level of motor milestone child is able to achieve. So 2 years old child or 3 years old child who's just started walking, then it is going to be a 1 year milestone age. You can say 12 to 14 months in range. It is going to be 12 to 14 months. Milestone age is 12 to 14 months. Same way, when we go to the reflexes, there are primitive reflexes or a brainstem reflexes which should be integrated to facilitate the development. Initially, in a child, the reflex is to serve as a voluntary function, and then gradually that reflex integrates and we get the voluntary function. Now that reflex is not getting integrated, like TLR supine, tonic labyrinthine supine, or tonic labyrinthine prone, or the ATN reflex, that is not being integrated. That's why it is coming in the way of developing a motor movement or a motor milestone. So that's the reflex age which we need to calculate, whether the reflexes are integrated, still persistent. So there is a full gradation of that. We are not going in detail about assessment. We are just going for basic difference between the cerebral palsy and developmental delay. Primary important for me is barriers to participation, because each and every child is having their functional capability. So when we see that child, what are the barriers? Where the child wants to participate? What is the function activity child is trying to do? And what are the barriers to that? If we work for that barriers, it's basically ICF-based evaluation, where we completely focus on the function. If we solve the function, automatically we are gonna get the results for the child. Where we go for a developmental delay, same chronological age, we need to see areas of concern. Areas of concern will be again domain dependent. So there are developmental screening tools are available which can be used for that particular child for the observation, for developmental sequence. It can be for motor Albertine, for motor scale, test of motor performance, or Bailey is having screening tool. Peabody is also having a screening tool which can be used for that. For all the children in which you want to do a developmental screening. Once you do the developmental screening and you find it, yes, there is a developmental delay and you want to go for a further evaluation, there are comprehensive developmental scales are available. Why it is being used? So developmental screening can only give you a guidance and okay, child is having some abnormality. When you go for a comprehensive developmental scale, it is going to give you a complete picture of where is the delay, in which domain it has been affected. For India, it is developmental assessment scale for Indian infants is a gold standard, DASI. Also, we can do Bailey as well. and all this scales needs a training. So those who are in working, especially in this kind of setup, they have to get trained for this, and they have to get the official certificate for this. If you want waiting, can we get it? Where are the workshops going on? Comment down below, and I'll give you the guidance about that as well. Domain specific tools, like I want to evaluate a motor domain of the child, I'm going to be using GMFM as a tool. And functional scales like VFIM can be used to mark the function of the child, and is mainly used for the older children. Yeah, management. So management, why the circle? Circle, it's a multidisciplinary approach. It's very complex in nature for either a developmental delay or cerebral palsy. When we see a circle in center, always the child is most important, and we all are working around the child. It can be a pediatrician, neonatologist, a physiotherapist, occupational therapist, speech and language pathologist, orthotics. Those who all are working is working for the child, and it's always multidisciplinary team approach works very well for the child. There are certain approaches in physical therapy, in occupational therapy, which can help a therapist to get the function done. Some another video we'll be talking about specific management of cerebral palsy for sure. Now, what are the key points and take-home messages? So when we compare the cerebral palsy and developmental delay, there is a persistence of pathological reflexes which are not getting integrated. In cerebral palsy, well, there is no pathological reflex activity in the developmental delay. When you see the cerebral palsy, there is abnormal tone, whereas the developmental delay is usually a normal tone or hypotone, and child is just not able to cope with it. This particularly in terms of motor development, I'm specifically guiding you. Delayed motor milestone, whereas domain-specific delayed symptoms, as according to the domain, the symptoms are going to be there. Non-progressive symptoms, injury, impairment, sorry, not symptoms. Symptoms in terms of non-progressing injury, musculoskeletal component will always vary. As a child is growing, the bone will grow, muscle will grow, and for that you will be having different strategies, and the particular picture of the child will be changing. But in terms of injury, it is non-progressing. There is no progression of the symptoms. Whereas here, if you see a temporary or permanent delay can be seen sometimes. So this is my basic understanding of cerebral palsy and developmental delay. So thank you so much for listening till now, and please comment down below if you have any questions regarding this. If you want to, this is my basic understanding of cerebral palsy and developmental delay. If you want to add on something, feel free to add on, and this is just a platform for the learning, and we'll continue the thrive of learning. In this COVID-19 situation, hope you and your family safe and home quarantine. Stay home, stay safe. Bye-bye.